this funding opportunity, looking at policy work, how you can use policies to affect health promotion and affect people's health, was a new approach for us and something that we were excited to get involved with.
Fred of Swanson originally approached me with the idea just to bounce it off me and to see what we could do in association with the festival. He said, is this something that we could do? And I forget exactly what his original idea was, but it was less than where we eventually went with it. And I said, well, why don't we just require it as a condition of being a vendor or sponsor at the event, to require some sort of smoking cessation policy or support that each organization or each company gives to their employees, since they're serving the community.
So when the funding opportunity came up, coming from CPPW, with this Communities Putting Prevention to Work opportunity, when that came up, we'd been doing tobacco work for about 7 or 8 years at that point. And we had done campaigns around helping people help their friends quit smoking. We, of course, were doing a lot of smoking cessation classes and offering support that way. We'd done a campaign that was more social justice oriented. And we really felt like at that point we had done the social marketing that we wanted to do, and we were looking for something new. So it was exciting to have an opportunity to do policy work and really look at helping people be healthy in a new way, and taking a new approach to health promotion.
Gay City has a history of approaching our tobacco work with sort of a different angle. I think that most people by now in this day and age have gotten the message that tobacco is not great for your health. And so we've always sort of taken the approach of tobacco is also a social justice issue, particularly for the lesbian, gay, bisexual, and transgender community, that this is an industry that targets us, that pushes their products on us, that has historically sponsored our events with funding, with placing advertising in our publications. And so we've always taken our smoking cessation work from that angle, that this is also a social justice issue.
Policy work is different. So for some people that's like implementing a new law, or so for example, seatbelt laws. That was a policy change that affected people's behavior. People wore seatbelts because it was a law, and if they didn't, they were going to get fined. And so using that approach, which seems a little bit Big Brother, but figuring out a way to do that differently was kind of interesting for us to think about. And so we were excited to try something new, and we met with Egan from PrideFest and said, here's our idea, and we want to figure out some sort of way to ask something of the people participating in Pride.
I think the combination of having the media campaign and then also having the actual policy project really raised some awareness in our community about not only tobacco companies marketing to us and sort of that history, but also it sort of created this expectation that businesses and organizations that serve our community should care about our health, and that might mean that they have policies in place that support our health or support us taking steps to improve our health. When we ask businesses to create a tobacco prevention and control policy, we really try to provide them with a range of options. So that could mean, at the most basic level, that they at least offer their employees or their organization members a referral to smoking cessation services. So something as easy as a referral to our state's quit line. We really tried to work with each organization or business to find a policy that suited them best.
As long as there was for some companies some minimal requirements that they could do. I didn't feel like it was too onerous, and it showed support for the community that they have access to at the festival. So I thought it was a good plan all the way around. The LGBT community has been very active in lots of different ways, whether it's through sports or health or for rights. And so we want to be able to support that. We feel like that's a core mission of the festival, to support the community in all the varied ways that it represents itself. We did our first Pride Festival in 2007, so 2011 was our 5th year. We have programming every year from the main stage Like last year we were able to show some Gay City documentaries and some other things from the main stage because it was our first year with a video wall. Last year we topped out at 100,000. It was our biggest year ever.
Some of the successes of the project were that, one, it really created a really useful partnership between Gay City as a health organization and other organizations and businesses that serve the LGBT community. We forged a really strong partnership with 1 Degree Events, who was the event producer for PrideFest. We got to work with a lot of local businesses, both small one-person operations all the way up to large corporations, which was a unique opportunity for us. We ended up with new policies created by 87 vendors. As far as this project goes in the larger context, it was a really great opportunity for Gay City to work with other health organizations, with public health departments. The community's putting prevention to work, collaboration crossed issues of tobacco use, of healthy eating, of active living throughout our county. And so we really got an opportunity to work with colleges, universities, medical organizations, and really see how many of our issues overlapped. But at the same time, we were able to design programs that work specifically with our population.
I think there were a couple real benefits to Gay City from this project. The first was, of course, our relationship with Egan and with PrideFest. And this was a great way to support PrideFest, and I think a really great way to set an example with Egan around expectations that we can set for people, for vendors at PrideFest. And so I think that there's all sorts of ideas and thoughts about other things that we could ask people to do that are not invasive, but are good ways to promote health and wellness through policy work. So that's exciting, and it was exciting for us to do something new. We'd never done policy work before, and so I think it allows us to really look at other opportunities for us to partner with organizations or community groups that are trying to do something, and strategize around, what are policies that we can put in place that makes this better, that makes the work you're doing more effective or better, or can have a positive health outcome for the people participating.
The folks over at Gay City Health Project were a joy to work with, led by their captain, Fred Swanson, who is a master at everything that he does.
I'll make sure he sees that.
Perfect.